Welcome to the Madness and Grace podcast, where we explore the connection between mental health and faith. I'm Dr. Matthew Stanford, neuroscientist, author, and mental health advocate.
And I'm Dr. Madeline Stiers, therapist and trauma researcher. We're so glad you're joining us today. Each week, we have authentic conversations about personal stories, we share professional insights, and explore the meaningful ways faith can influence mental well-being.
Whether you're seeking comfort, understanding, or simply a new perspective, we're here to journey with you. Thanks for tuning in. Now let's dive into today's conversation.
Hello, everyone, and welcome back. We're glad to have you joining us today. Today, we're going to talk about faith and therapy and whether they can work together. What does that look like? So a lot of people have interest in integrating their religious beliefs, their spiritual beliefs, or their faith into therapy. And so what does that actually look like? What are some of the statistics? Does it work? Is it available? I think those are all good questions and something that we definitely address here at the Hope and Healing Center and Institute.
Yeah, thanks. Here at the Hope and Healing Center, we do integrate care with our faith. So I think today we want to kind of dispel that myth that faith and therapy are somehow in opposition. And they certainly, as you mentioned, can be integrated. And I think that that's an important thing to talk about. What does that look like when you integrate faith into your therapy? What's a good way? What's a bad way? I think one thing that's very important that people realize, both those that might be out there that are providers and those who might be people seeking care, is that really, regardless of who you are, it almost always comes up in therapy that people want to discuss their faith, whether you use an integrated approach or not. I know when surveys are done of people about do they want their therapist to talk about faith, do they want to talk about faith, the overwhelming majority want to. We are a very faith-oriented society. Most people in the culture that we live in believe in God in some way. And they want to discuss that when they're talking about, their mood issues or their thoughts and behaviors. And so it should be no surprise to anyone that these things come up in therapy, whether you're in a faith-oriented environment or not. It's just how the therapist responds and how they've prepared themselves. I think the other myth we want to kind of dispel today is this idea that every psychologist out there, every counselor out there that isn't advertising themselves as a Christian counselor or using some kind of integrated approach to care is trying to destroy people's faith. I have heard that. I laugh because it makes me laugh because I know the mental health care system and I know lots and lots and lots of counselors and lots of providers at all different levels. And I don't know that I've ever met one that was out to destroy people's faith, but I have heard lots of Christians tell me they believe that. And so,
Really, it's the opposite. When you're talking about faith versus therapy, both of them have the same shared goals of alleviating suffering and finding purpose and meaning in life. It's
connection. Absolutely.
Right. Yeah. So we do get a lot of calls here, people looking for referrals, and they're I need a Christian counselor. And that's great. And a Christian counselor can be wonderful. I'm not ragging on that at all. And you can find a counselor that doesn't advertise themselves as a Christian counselor who will also integrate your faith. That just might look slightly different. A Christian counselor is going to sit down and they're going to walk through like scripture with you, and they're going to talk about religious beliefs and some of those practices, and they may get a little bit more deep into that religious practice, whereas someone who is going to integrate religion into therapy is going to ask you some questions. They may work with a wide range of religious beliefs. They're not likely going to share their religious beliefs. They're not going to be proselytizing or pushing certain, scripture or religious practices on you. They're really there to say like, hey, tell me about your religious beliefs. What is your faith? What does that look like? And let's talk about how that can be a pillar of strength or a foundation for you. When was it? When has it been harmful? Let's talk about using it in a way that you want to get to. And they walk with you in that journey of understanding how your faith and your religious beliefs can be a positive thing. And if it has been a harmful or hurtful thing in your life, kind of processing through all of that. I mean, that's really so faith and therapy can work together, and they do successfully work together. I mean, we do it here.
Absolutely. Absolutely. I think that, it's important for people to realize that, we are kind of here at the Hope and Healing Center, we think about people as kind of a multi-part being. We have a body, we have a mind, we have a spirit, and then we are in relationships with others. We kind of see that as a kind of a biblically described way that we exist. And so if you look at something like, Luke 2:52, Jesus grew in wisdom and stature, favor with God and man. Those are kind of the four aspects of our being. And when you have a mental health problem, you're affected at all those levels. In fact, if you have any problem, you're affected at all those levels. So if I do not approach you from what we refer to as a holistic approach to care, where I'm dealing with you from a physical, a mental, spiritual, and a relational perspective, all of those at the same time, well, then I'm really just ignoring aspects of your being, and I'm not giving you a comprehensive approach to your care. And so that's the way we think about it. So we certainly can kind of piecemeal those things. You could go to a therapist who doesn't integrate faith, and then you could also go to your pastor or a pastoral counselor and receive kind of spiritual guidance and intervention. You could go to a physician for the physical. So, I mean, they can be put together, but I think we need to think about ourselves in that way and those that we serve in that way. And when we do that, then we realize that it's not surprising that they bring up their faith, because they are a complete being and faith is important. Even if you don't really particularly see yourself as a person of faith or a believer, you have big questions that are really only answered within the kind of hallways of faith. Why am I here? What's my purpose? Those types of things. And so those kind of questions are going to come up. So I think it's important for faith communities to equip themselves in relationship to mental health, but I also think it's important for people to really understand, what do we mean when we say therapy? I think that is one of the biggest things that I run into. And the place I would start is, what's the difference between counseling and therapy? Okay. And so there's a difference, and they see different people. Someone who advertises themselves as a counselor oftentimes sees different kinds of clients than someone who advertises themselves as a therapist or a clinical psychologist. And so I would say counseling is kind of structured guidance and advice, whereas therapy is a targeted intervention to minimize and, I don't know, when you use the word prevent, I would say minimize and treat specific problematic symptoms. Yeah. Mm-hmm. And so one is like a targeted treatment, and one is more like a structured guidance and advice. It's not to minimize either one. They're different.
Right. And, you hear the term talk therapy a lot now.
Right.
And that falls more in line with counseling. Again, nothing wrong with it. It's just not developed. It's developed for individuals who need maybe a little bit lighter support and structure and guidance than those who are really struggling a little bit more heavily.
If let's say you have bipolar disorder, because we tend to, here on Madness and Grace, we tend to talk about serious mental illness more than we do what we think of as counseling issues. And so, because here at the Hope and Healing Center, we focus primarily on serious mental illness. So bipolar disorder, a serious mental illness. A person with bipolar disorder does not need to go see a counselor. They need a psychotherapeutic intervention, a targeted, approach to kind of dealing with the symptoms associated with bipolar disorder. Whereas, say, somebody's having a marital problem, marital counseling. Someone's having a problem, kind of stress-related issues on the job, counseling. A lot of times you think about, these are kind of rules of thumb I heard, back in the day, back in the ancient times when I was in grad school. Counseling, that's people with problems. That's what that is. Whereas therapy, that's more disorders. And
another term people say is the worried well.
Yes, that's a good one.
We're generally well, but worried about things.
Exactly.
Go to counseling.
We're not talking about necessarily a mental illness per se. Now, that being said, the line is very gray. Mm-hmm. You and I both know plenty of people that are counselors, that's how they advertise them, and they have training to work with people with serious mental health problems. And we also know people that are Ph.D.s, that they got a Ph.D. in counseling psychology, and they just do counseling. And so there's also this kind of rule of thumb that counselors tend to have master's level and more therapist, kind of clinical psychologist or Ph.D. But again, that's not always true either. But the important thing to remember is that there is a difference between counseling and therapy. And so what we find with faith communities, for instance, is that they tend to be much more receptive to Christian counselors as far as referrals go. And most Christian counselors are master's level counselors who are not trained to work with people that have serious mental health problems like bipolar disorder and schizophrenia and things like that. Nothing wrong with that. Very important that they exist and that they're out there. It's just that you have to make sure you're making good referral. And so, you don't send someone with schizophrenia to your local licensed marriage and family therapist.
Right. Someone who is in the depths of a serious mental illness and you're trying to get them connected to care. The fact that the therapist is a Christian does not need to be the primary focus in that moment. Now, maybe later when this person has their symptoms managed and their mental health is a little bit more managed, then they can talk about, what they might like to see a little bit more. But the Christian counselor, again, wonderful, isn't necessarily going to be the person to address the severe acute symptoms that a person with bipolar disorder, even, suicidal ideation, borderline personality disorder, they're really in need of someone who's implementing therapeutic, evidence-based interventions such as cognitive behavioral therapy, dialectic behavioral therapy. There really is a difference. But I think for the most part, though, and we get this a lot, we have a group of, a network of referrals that we can send, the people who show up at our doorstep here that our therapies aren't going to benefit them. They really just need a counselor. We refer them out. And then we have those counselors out in the Houston area that refer into us for people who show up at their door and say, maybe their faith community referred this person to me, but they're really struggling with some psychosis. It looks like maybe bipolar disorder or schizophrenia, and that's beyond the scope of what I do. So I'm referring them to you guys over there at the Hope and Healing Center and Institute. And so getting, if you're a counselor out there, getting connected with places that do work with serious mental illness, and then vice versa is really important because it can be hard. Like you said, that line is gray. When does someone cross into SMI? What does that look like? And
exactly. No. And you could just be seeing the very early stages of it before you've met criteria, and it's kind of preclinical. So I think, one of the things we have to understand is that when we talk about this idea of faith versus therapy, there is no faith versus therapy. We're talking about someone who's struggling with pretty significant psychological distress, and it would be helpful for them to see a mental health care provider and receive some type of therapy to kind of help walk them through this. But faith is in no way minimized by that. In fact, as I said, if we look at people the way God has created them, or the way God has created all of us, body, mind, spirit relationships, then therapy is just a part of the overall treatment, either integrating faith into that therapeutic approach or receiving pastoral counseling and care or some kind of lay counseling through your faith community is an important part of that. And so I think another aspect of that is a lot of times people are very confused by the difference between, say, someone who does talk therapy, however defined that is, a counselor or a therapist or whatever, and a psychiatrist. A psychiatrist is a medical doctor that prescribes medication to treat mental health problems. And on the other side, they use a kind of a therapeutic intervention where you're talking, you're learning skills, cognitive skills, things like that. And so if you go to a psychiatrist, that person is only going to prescribe medication to you. That's the tool that they have to help treat that. Therapy and medication together usually are more effective than one alone. And, just because you're receiving therapy doesn't mean you have to take medication. And so it just depends, depends. So I just think it's important that people understand the difference there. So if you're going to go to a therapist or a counselor, you may or may not end up taking medication. That person can't prescribe you medication. You would have to go to someone else, a psychiatrist, for that. So I just want everyone to understand there's kind of a broader set of tools out there for treating mental health problems than just one or the other, or just pray, or just, again, always get back to this idea of kind of recognizing that people are kind of multifaceted in how God has created us. So it's not a, versus you just need to pray more, don't go to the psychologist. You would never tell that to somebody who had cancer. You just wouldn't do it. I mean, you wouldn't say, well, you just need to pray more. Don't go to an oncologist, because they might give you a medication to treat your cancer. It sounds kind of ridiculous when you put it in that context, but the reality is that we do that all the time, unfortunately, when we get into this kind of dichotomy here of I'm either going to go with my faith or I'm going to go with therapy. And the reality is that as we do here at the Hope and Healing Center and many others do around the world, you can very successfully integrate faith and therapy together as a singular treatment.
And I think people are doing that much more now. I think just in the last 5 years since COVID hit, mental health has been a topic that has been, they're still very stigmatized, and people are talking about it a bit more on social media and in the news, and it's becoming, the awareness is coming a little bit more large. And with that conversation, I think people are able to say, like, no, my religious beliefs and my faith are important to me, and it's either I want to be talking about that when I'm in therapy. It's what I want to talk about. And like you were saying, this research shows that clients do want their therapist to ask them about their religious beliefs, and therapists, they find that it is helpful in treatment of people who are struggling with their mental health. And so we've got both sides going, yeah, this would be really, really, really helpful. And it's still just not happening as much as you would like. Who's to take that first step? I would say, as the therapists, doing a good intake assessment, you're asking those questions, like, is your faith something you want to be talking about? But clients out there listening, if your therapist doesn't ask you that, bring it up.
Right. No, you do have it, like you said, from both sides. I think that's a good way to look at it. On the therapist side, unfortunately, in most of our training programs, people are not trained on how to effectively assess the importance of a person's faith, what a person's faith is. I mean, faith is very diverse. I mean, even within Christianity, there's a lot of variations on how Christianity is practiced. And so, no individual therapist is going to be an expert in all the religions of the world and every denomination within Christendom. And so, that becomes a problem. And I think what I've seen is that then therapists just kind of, they shy away from it. It's like, well, I'll just ignore that. They can go to church and talk to somebody about that if they want to. When the data shows people want to talk about it in the therapeutic environment. And so that's the problem on that side, is that therapists just aren't trained to effectively integrate it or trained to effectively discuss it, so they ignore it. And then on the other side, on the faith side, you've got pastors and clergy of various ilks and lay counselors and congregants saying things like, well, this is just a spiritual issue. You shouldn't go to a psychologist because that's the godless world out there, and they're going to try to destroy your faith. And so, really, the person's getting it from both sides.
And really, we know that for religious people, religiously integrated therapeutic treatments have been shown to be effective and enhance clinical outcomes. So their depression lessens, their anxiety lessens, their symptoms lessen. I mean, we're not just saying because we're religious people here on this podcast saying like, yeah, integrate it because we think it's great. Like, there's studies out there that show that for religious groups, integrating that into their care actually enhances their treatment and their outcome results.
It's one of the hottest topics in mental health is discussion of spirituality, religion. I mean, that's super hot. There's tons of research on this.
There's tons of research on religion and how it's a protective factor for your physical health.
Right. It's not just something we like and we're telling you should go do it. I mean, this is what the data shows. And, unfortunately, our training programs haven't caught up, and they're just not training. Now, they do recognize that religion and spirituality are important multicultural factors. And they say that people should be competent, the therapist should be competent in them, but then they give them no training on it.
I mean, that's for most of the clinical licensures across therapy.
Absolutely.
You have to be culturally competent. And what does that mean?
I just laugh. I always
awareness,
laugh with the word competent.
Competent culturally in every culture. Like, what does that actually mean? What I think about it?
Really ought to be aware. I think
awareness.
I think competent is a laughable threshold.
It's working. And what they say is you're constantly working towards competency. You should be working towards competency. Yeah. And I'm like, in everything all the time, that sounds very overwhelming. Yes. But I mean, a lot of it is, you do get to ask your clients questions, and that's where we're kind of going back to like what Christian counseling is versus faith integrated therapies. Christian counseling is talking about Christian beliefs, and you're going to have this standard kind of like through line of what that is. And the the counselor may even say, no, this is what Christians believe. And this is,
Right. This is what our faith teaches us, and
right.
things like that.
Whereas like a faith integrated approach, which is what we use here, we're a Christian agency and we work with clients who are not Christian at all. We've had clients who practice Judaism, Islam, I mean, like all over the board. And so part of that is like, tell me about your faith. Tell me about your spiritual beliefs. What does that look like for you? What's been helpful? What's been harmful? Getting to know and assess what that aspect of that person's life looks like. And
oftentimes really, those individuals come here because they can't find
it elsewhere. Yeah.
Therapists that will discuss faith in the context of their care, even if they're discussing faith from a different perspective, even if they're discussing Christian faith. It's
wild to me because you would never go. It would be appalling to hear that if you you go to a therapist and you're not feeling good, you need some support in something, and you say, I can't seem to eat. Like my eating habits have really changed. And when I do eat, I'm just not eating healthy and it's really bad. And like, I really want some support on figuring out ways to get me back to eating a little bit healthier. And the therapist says, well, I'm not a dietitian. Right. I'm not going to talk to you about your eating habits. That's, something that you need to go deal with somewhere else. Now there's a point where someone does need to talk to a dietitian, but these are symptoms of things that are associated with our mental health. They're intertwined. We are holistic people. Right. We're not going to give advice on things that are outside of our scope, but processing through and talking about a person's religious beliefs is important. Someone comes in and sits down and says, what does God think about X, Y, and Z? Right. I'm going to go, that's a really good question. Like, what are your thoughts on that? And sometimes they do push me and say, well, what do you think? What do you think? And I go, well, I'm not a theologian, so I can't answer that question. But let's talk about why this is such a burning question for you. And then if they don't have a faith community to refer them to go ask, right? Getting them connected with one.
The role of the therapist is not to force your beliefs onto your client. That's actually being unethical. You're there to help. You're there to walk along with them and to kind of help them work through this issue. And, again, when we're doing therapy, we're using a very targeted. So like, maybe you're dealing with negative thinking because you have depression. So we're teaching you how to restructure your thoughts, giving you some tools on how to do that, which is a very different thing than if you come in and you were to say, I'm not getting along with my wife. What do you think about that? Or this is what she does, and I don't know how to react to that. I mean, those are, just very counseling and therapy, very different. Some of the things that I hear from pastors or from people of faith, Christians, when they're, and some of the nerves they have around, going to a therapist is that, therapists are somehow of the world, and they, and like I said earlier, they're going to destroy your faith. And the two things I hear the most, the two examples I hear the most, particularly the first one is from pastors mainly, and that is, well, I'm afraid to send my people, to a therapist or in the world because they might tell them to get a divorce. So that that this situation, I sent them, I once sent I had a guy tell me when I once sent a couple to this counselor, and he ended up telling them the best thing they could do was get a divorce. And so now again, I got no context for what that was all about and what was going on. So, but that, and so at least in that pastor's mind, there's absolutely no circumstance under which anyone should ever get a divorce. And if a therapist would ever recommend that, that was a bad thing. Okay. And so that was one thing. And then I think the other thing I hear a lot more nowadays, and I'm not trying to open a big can of worms here, is the LGBTQ thing, that, someone's going to say, well, that's an okay behavior. Or you should just live your life the way you want to live it, or something like that. I mean, it varies in what but those are the concerns that I hear. Those two are the ones I hear the most. I don't usually hear like they're going to say Jesus wasn't God. I mean, they don't, some kind of doctrinal, there's no Trinity, it's not that, it's more of a cultural, kind of like get a divorce, practice this behavior. I mean, I don't think any pastor thinks that there's a therapist out there going, well, you should use drugs, you should shoot meth, so I mean, it begins kind of ridiculous if you start to think about it. It usually is around just a couple of specific kind of things, this idea of destroy, but I do see it put into this broader context of to destroy your faith.
And
go ahead.
I hear people when they call and they're looking for referrals, if it's not coming from a pastor or a clergy person, they're going, okay, I need a referral. I need a therapist. I really want a Christian counselor. And so I ask, how important is that to you? Because I could also send you some referrals that they don't advertise as that, but they might be willing to integrate your religious beliefs. And they go, well, if they're not a Christian themselves, I don't think they'll understand. Right. And I go, so you're dealing with like a spiritual issue? And they're like, no, it's just a big, important part of my life. And I'm like, okay, and then provide the referral as they needed. But I'm like, therapists are trained to work to understand if you can be a therapist and not have children and still help someone understand parenting behaviors and behavioral management of children.
You don't have to be married to be a marital counselor.
Exactly. So, you don't have to be a Christian to walk with someone through their Christian
in a compassionate and caring and affirming way. So that's why we often talk about be faith affirming. They're going to affirm you. So if you go, I'm just going to say to those out there right now, and you tell me if you agree with me, Maddie, or not. If you go to a therapist and you say to that therapist during one of your sessions, well, I really would like to talk about how this all is affecting my faith. And they say, well, I don't talk about that in here. You'll have to go somewhere else. Me personally, since you want to talk about that, my suggestion would be that you look for another therapist. Find a different therapist.
Yeah.
In the story. Want to talk about that, and they don't want to do that because they either don't agree with talking about that in the session, or they don't feel equipped to talk about that in the session. So I think it's time to find another therapist. I mean, and
there's a difference, though. I do want to point out, I agree with you. I do agree with you. There's a difference, though, because if someone were to ask me to discern scripture to them, I would say different. I'm not trained in that.
Right.
I can talk to you about what you think it means, and then I'm going to have conversations about religion and spirituality and your faith. I'm willing to engage in those conversations within limits. Same thing if someone were to come into me and say, I'm going through a divorce with my spouse and they're withholding my children, and legally I don't think that the blah, blah, blah. What do you legally think I should do? I would say, I think you need to talk to your lawyer.
You're not a lawyer. That's right.
That is outside the scope of my work. But how you feeling about it? Like, what's going on? It sounds stressful, So, and yes, I agree with what you said. And
I see what you're saying. There's a willingness to be involved in a conversation and incorporate that within the session in some way. And then there's like a threshold of what exactly is it that you want to discuss. Like if they were to say something like, well, I did this, do you think that's a sin?
Right.
Okay. Well, what I would say is well, first I'd like to know, do you think it's a sin? And why do you think it's a sin? Because ultimately what I think is not again, this is where people misunderstand what goes on in therapy. You don't sit down in therapy and Dr. Stiers says to you, tell me your problem. And then she tells you the 8 things that you need to do and you're fixed and you better do them exactly right. And so that's not therapy. Therapy is a process.
Life would be so much easier.
Oh, it's so much easier. Therapy is a process where you have to bring the person along as they work through this with their own views and beliefs and history. And so that's why it takes so long. And, you don't just, if we could just tell, I would just write a book that had all the answers in it and then everybody would read it and we'd never have to worry about it again. So
I think one of our next few episodes should be, what is bad therapy?
That's not a bad idea.
We talk about that a lot through, we'll go, oh, if they do this, no.
And there is bad therapy.
Yeah,
there
absolutely.
Are, just like
there are bad therapists.
There are good mechanics and there are bad mechanics. There are good counselors and therapists, and there are bad counselors and therapists. And we see them every day, unfortunately, because that's what we deal with. But they're not bad just because, say, they don't advertise themselves as Christian counselors, or they don't integrate their,
Bad
faith
because they
into
fell
that.
asleep in session on you.
Or they cuss, or they do. I mean, they're just like they're bad teachers. They're so that you need to go to a qualified, compassionate, and well-trained therapist. And Hope and Healing Center, we can help you find that. That's one of the things we do here. So I think when it comes to this idea of faith versus therapy, there is no faith versus therapy. There's therapy and there's faith. And there's a lot of other things. And all of that's important for a person of faith when they are trying to get through some type of a psychological distress that they're dealing with, whatever that might be. So, Maddie and I would be the first to tell you that we think faith is a very important part of that recovery process. And I even think that faith is a very important part of that recovery process who people don't think it's an important part of the recovery process, because I think that's how we've been made. But can you go to a therapist and not incorporate your faith? Yeah, it happens all the time. People do it all the time. And if you want to incorporate your faith, then you need to find someone who's willing to do that. So if your therapist doesn't bring it up, you need to bring it up. And, like one of the things at the Hope and Healing Center, when we vet providers for our referral network, we want to know, how they would handle religious clients. You don't want someone who's like, well, I don't really believe in that mythology. You can go. That would not be a good thing for a client to have someone say to them in a therapeutic session. So faith affirming is very, very important. So I just don't think that, I think this is a false dichotomy that's been set up on both sides. I think you made a good point on that, Maddie, on both sides.
Yeah. So. All right. Well, thanks for joining us again today. And thanks for the conversation, Matt. It's always fun. Maybe we really will do an episode called...
I think that's a great idea. We actually could just...
got a lot of stories.
Tell you the truth, we just tell a lot of stories. I've got some horrible stories. Oh, so bad.
It'll be our campfire episode.
We could do... How about we do bad therapy and bad churches? We could do it kind of like we're doing faith versus therapy here. We could do it on both sides when it comes to mental health.
To support and care. Yeah,
man, there's some bad. Sometimes it really amazes me that people come up with what they come up with, and they think that's going to help somebody. So anyway.
It's so sad. It's so sad.
Thanks for joining us, and we'll see you next time.
Thanks for joining our conversation on this episode of the Madness and Grace podcast. If you found value in our discussion today, we'd love it if you'd subscribe wherever you listen to podcasts so you never miss an episode.
And if you enjoyed what you heard, please consider leaving us a rating and review. It helps others find these important conversations.
Sharing this podcast with friends and family members is also a wonderful way to extend hope to those who might be struggling with mental health concerns.
We'll be back next time with another candid conversation about madness and grace. See you then.